State of Maine Medicaid expansion feasibility study. And also we welcome the Commissioner and all of the legislators that are here to hear from the media to hear this report. And we will start this afternoon with introductions, and start with Representative Stuckey.
Thank you, Madam Chair. Good afternoon. My name is Peter Stuckey. I represent House District 114, which is part of Portland.
I'm Representative Carol McElwee, and I represent District 4, which is located in the county, as we endearingly call it, and the city is Caribou. Welcome, everybody.
My name is Ann Dorney. I represent District 86, which is Norwich, Waukegan, and Madison. Welcome.
Jim Hamper, Senate District 13, Western Maine.
My name is Colleen Hovich. I represent Senate District 25, towns of Waterville, Winslow, Albion, Pittsfield, Detroit, and Township.
I'm Representative Dick Farnsworth, representing House District 117, which is a part of Portland, and I'm happy to be the House Chair of the committee.
Good afternoon. I represent Drew Bettine. I represent District 126, which is part of the city of Westbrook.
Hello, Richard Malaby. I live in the town of Hancock. I represent House District 34, which is a portion of coastal Hancock County.
Good afternoon. I'm Debs Anderson. I represent District 52, which is Chelsea, Whitefield, Washington, Somerville, part of Jefferson, and the unorganized township of Hubbard School.
Good afternoon. I'm Catherine Cassidy from Lubec. I represent District 32, which is 8 coastal communities in Washington County.
Good afternoon. My name is Matt Peterson. I represent House District 92, which includes the towns of Andover, Rumford, Roxbury, Byron, Wells, Sandy River, and Rangeley Plantation, plus the unorganized territories of West Central Franklin and Madrid Township.
Thank you very much and welcome. And we are also joined today by our Ropa Anna's Jane Arbiton, and I think Anna Boone will be here, as well as our committee clerk, Beth Walker. And we will now invite Mr. Alexandra and the Commissioner to please join us, or anybody else who would like to join, to come up to the podium. We do have 1 hour to include the reports presentation. We would like to allow some time for questions from the committee, and so we were thinking maybe 20 minutes, 25 minutes. Is that enough time to do at least an overview of the report and then to have a conversation?
I think we can accomplish it in that amount of time.
Okay. Thank you very much. And we're delighted that you could come here. It's always very useful to have a face-to-face, and we thank you for coming. We thank the department for joining him and for allowing him. So please, you can introduce yourself and start wherever you'd like.
Good afternoon. My name is Mary Mayhew, and I am the Commissioner for the Maine Department of Health and Human Services. I am joined by Gary Alexander and Eric Randolph from the Alexander Group, and I'll let them provide a little bit of intros in terms of their experience. But I wanted to certainly start. The intent today is to provide you with background related to this study that we commissioned to look at the implications of Medicaid expansion as we evaluate many challenges confronting not only just the Medicaid program, the Department of Health and Human Services, the state budget, and certainly as we look at addressing a multitude of needs for the people of the state of Maine. What we certainly looked toward in this report was the opportunity to avail ourselves of the expertise through the Alexander Group to look at models and methodologies that allow us to forecast and understand various variables that will affect enrollment under expansion, that will look at what the costs and the implications may be for the state budget, for the Medicaid program, as we contemplate other current and future financial challenges for the program related to a host of other pressing needs, many of which play out in this committee room every single day, related to serving the needs of our population, certainly those with disabilities, our elderly, understanding whether or not the adequacy of our safety net of providers is meeting our goals as we evaluate current reimbursement rates. So it is in that context that we wanted to benefit from a comprehensive review of the implications of expansion on the program, on our budget, and to be able to evaluate it through that much more comprehensive lens. So with that, I would like to introduce Gary Alexander and Eric to have them walk through the presentation. You all have copies, I'm hoping, of the presentation? Yes. Okay. Gary?
Good afternoon, Committee Chairman. It's a pleasure to be here today in your beautiful state, and we thank the Commissioner for all the work she is doing and for the assistance she provided the Alexander Group to receive important data to accomplish this project. My name is Gary Alexander. I've served as the head of Health and Human Services in 2 states in my previous life. I am a Rhode Islander. The bulk of my professional career in the human services industry was spent in Rhode Island, and so I'm a New Englander like all of you. We have assembled a professional team to do this report that have significant experience at the highest levels of state government. Eric Randolph is our fiscal and economic analyst who performed a lot of the work on this report, and he's here as well as I to answer questions. The Alexander Group employed a professional actuary and a chief financial officer formerly from the state of Rhode Island to analyze Maine's system and come up with the best methodology possible. If we could turn to page 3, and what I will do is I will indicate the page so that everybody can follow along. We all know that the Affordable Care Act of 2010 mandates that states expand eligibility for their Medicaid programs to include all persons with incomes equal to or less than 133% of the federal poverty level. This is really the first time that the federal government has set a limit with the federal poverty limit, and actually mandated that states cover everybody under a certain limit. We do know that subsequently after the Supreme Court ruled that Congress had exceeded its authority to give the states this mandate, and thus now the states have a choice as to whether or not they can expand. Page 4. We thought it necessary when analyzing Maine's system to look at Medicaid growth nationally, and we looked at the U.S. Department of Health and Human Services Office of the Actuary report in order to be able to do this. Just in a nutshell, if all states expand Medicaid nationally, total enrollment would increase over 50% nationally, and we would have about 85 million people in this country on Medicaid. Total costs would grow by over 94% to over $830 billion by the year 2021. This begins to eat more and more of our gross domestic product nationally and overtakes other federal programs. Page 5. During 2012 through 2021, Medicaid expenditures, according to the Office of the Actuary, are projected to grow at about 6.5% year over year, and this is actually 1.1 percentage points higher than it would be under the Affordable Care Act. So even if the federal government had not mandated Medicaid expansion, or states did not expand Medicaid, Medicaid would still be growing nationally at over 5% year over year, which is still a significant growth factor. Page 6. The impact on the states, we wanted to now narrow in our focus to Maine, and one of the things that we wanted to look at was the Maine budget and how Medicaid fits into the Maine budget vis-a-vis K through 12 education. And if we look at all funds, not just state funds, but all funds combining federal and state funds, as you'll see on the chart, Maine Care is on an upward trajectory, and K through 12 has been moving, K through 12 funding has been moving in a downward trajectory, although of late it has spiked up a bit. Maine spends the third highest percent of its total budget on Medicaid of all the states. Page 7. In Maine, all states deal with what's called FMAP, which is the amount of money that the states receive from the federal government. It's a matching rate. Usually we hear if we spend 50 cents, we gain 50 cents. And it's all based on per capita income. There is a complex calculation where you divide the state per capita income over national per capita income. And Maine's FMAP rate, or matching rate, or funds that you are getting from Washington, has been moving in a downward trajectory for the past 10 plus years, with the exception of the ARA stimulus money that came in 2009 that spiked up our federal match rate for our normal Medicaid programs. Each percentage point drop in your matching rate from Washington, the money you receive, results in about a $25 million reduction in federal funds. So for each point we lose in Maine, the state of Maine loses $25 million, and with that, the state has to make up for that with state general funds. It is anticipated that states will again see further reductions in FMAP rates as fiscal problems continue to plague the federal government. Page 8. There is a risk that the federal share will continue to decline, and it's important, I think, when we're making any decision on Medicaid expansion to look at this. Record federal deficits and national debt exceed 100% of the gross domestic product. Medicaid has the highest growth rate of any major spending category. And just in November of 2013, the Congressional Budget Office projected that one of the ways to control the federal budget would be to cut Medicaid spending. And they speak about a reduction in the match rates that the states would receive. So you'll see on those tables the deficits, the 10 largest deficits and over the years, and inflation adjusted for billions of dollars. We use the base year of 2013. And then the debt to GDP and government debt to GDP, comparing the United States to European countries, our debt is very high nationally. And the reason why this is important is because it does have implications for the federal money that states receive from Washington, D.C. And unfortunately, we receive money that's always in constant fluctuation, which gives state legislatures very little budgetary certainty. On page 9, please. We considered 4 risk factors. So the financial model that we created assumes a middle value in going forward, but there are risk factors to the forecast, and those risk factors give us a high-end and low-end factor. The 4 risk factors that we examined were the poverty growth, the per member per month costs to your Medicaid beneficiaries, what it's costing month over month for each Medicaid beneficiary, the private drop rate, how many people might drop their private health insurance to access Medicaid, and then, of course, again, the FMAP rate, the federal money that we receive from Washington, that match rate. Page 10. Looking at enrollment, we show here a red and a blue line. The blue line represents a baseline forecast that we did, which is if we do no expansion at all in the state of Maine based on those 4 risk factors, what would happen. And the middle solid line is the middle value. It's not the high and not the low. And our calculations show that if Maine does nothing, that the state will have over 400,000 individuals on Maine Care by the fiscal year 2023. And that 10-year growth would be at 28%, an annual growth of 2.5%, which is not an anomaly in looking at other states. But if Maine does perform the expansion or accepts the expansion, the 10-year growth grows to close to 67% with an annual growth of about 5.2%. And that enrollment growth grows significantly. If you look at the middle value, or the red line straight forward, would grow to 530,000 plus individuals on Maine Care. Once again, that's the middle, not the high or the low. Page 11. It's important to look at Maine Care as a percent of population because your Maine Care population has been growing. Currently, you have 24.7% of Maine's population enrolled in Maine Care. We project that this percentage will grow to 29% under the baseline, meaning if there is no expansion of Medicaid, Maine Care will grow to 29% as a percent of population by the year 2023. Under the expansion scenario, Maine Care would grow to 37.9 or almost 38%, and that's the middle value. So if you look at the bar graph, you'll see on the far right-hand side the middle value of 37.9%. And the chart also shows you the high and low values. So based on the 4 risk factors that we deployed. Page 12. The cost of expansion for Maine, based on the risk factors that we utilized. The blue line, once again, is the baseline. The red line is the expansion. For expansion, the 10-year growth for 10 years would be over 100%, which means your population would double, or the cost would double, I'm sorry. Your annual growth rate would be at about 7.4%, and your total cost for Maine Care would be at about $5.5 billion. With no expansion, the 10-year growth rate is at about 70%, and your average annual growth rate is at about 5.5%, with the cost being about $4.6 billion. Page 13. What does this mean for state funds, more importantly? For the expansion scenario, state costs would reach about $33.5 million in 2014-15, or $45.3 million if the higher matching rate is denied for the childless adult waiver population when compared to the baseline. And it will grow to $125 million by the year 2023 when the state is in full-blown mode to spend at least 10% of the costs. Or state costs. On the left-hand side, you'll see that for the first 2 years, the range in costs to the state would be between $65 million to $86 million. For the first 5 years would be between $251 million to $284 million, and for the first 10 years, $807 million to $840 million. These are all based on those numbers are based on whether or not the higher matching rate is denied for the childless adult waiver population. Page 14. Maine Care's budget growth. In state funds, Maine Care services have been growing faster than the rest of the state budget, about 6% average annual growth versus about 2.2% for the rest of the budget. Our financial model forecasts that the baseline, the blue line, average annual growth rate will be about 5.5%. If Maine elects to expand eligibility, the rate becomes 6.2%. Page 15. The percentage of the general fund budget dedicated to Maine Care is projected to grow from 24.2% in 2012 to 36.2% in 2023 under the baseline. if Maine does not expand Medicaid, Maine Care is projected to grow from 24.2% to 36.2%. Under the expansion scenario, Maine Care will take in about 38.7% of the state's budget, not counting federal funds. This is our middle value, not the high or the low. For the overall budget, including federal funds, Maine Care will require 45.3% of the total budget under expansion in 2023-24, as opposed to 40.2% under the baseline. So significant growth in the budget. Page 16. One indicator on the economic impact is to look at the amount of people employed to the people on Maine Care. Now, when we looked at this, we did not look at all of the programs at DHHS, only Maine Care, but under the Maine Care expansion, if no expansion were to happen, or currently, I'm sorry, right now, each Maine Care enrollee was supported by 1.8 employed Mainer in 2012. So for every 1.8 employed person, there is one person on Maine Care. If Maine chooses to expand, each Maine Care enrollee will likely be supported by only 1.3 employed Mainers in 2020. That's page 17. What are the expansion impact on the current populations? There are well over 3,000 persons waiting for specialized and vital services in Maine. These are intellectually disabled and elderly and children. And the annual state cost to eliminate the wait lists and care for these vulnerable populations is about $50 million. What we would say is that the expansion does create a choice that the state may have to make. It's not a conclusion we have, but it may create a choice where the state may have to choose funding individuals on the wait list or expanding Medicaid for primarily able-bodied individuals. We tried to keep it very brief, Madam Chair, and we appreciate the opportunity to be able to present this to you. We're here for any questions you may have, Mr. Randolph and myself.
Thank you very much, Mr.